You're watching the Wellness Hour, leader in medical news and information. I'm Rady Rahban. Today's topic, mommy makeovers. With us, we have the most popular, the hottest plastic surgeon in Beverly Hills, Dr. Rady Rahban. Dr. Rahban, welcome to the program.
Good morning. How are you, Randy?
Now, this mommy makeovers, I mean, it really is, you say, a hot topic. More and more people are coming in for this.
Yeah, I think definitely. I think as people are becoming more educated with the concepts of plastic surgery, it's becoming increasingly common, women coming in for their breast, their abdomen, liposuction, things of that nature.
Is that what defines, by the way, in your mind, the mommy makeover is what, breast?
I think mommy makeover, it's kind of a catch-all term. And essentially the three main areas is breast augmentation, breast lift, breast manipulation. There's abdominal surgery in the sense that there's tummy tucks, and finally there's liposuction.
So you do it all at once?
You can do it all at once. Depends on the patient, but in general, that collective three is the most common procedure. And then there's ancillary services and things that we do in addition. But I would say that's the core three procedures that kind of comprise what a mommy makeover is about.
Now, before we get into today's topic, tell me about your practice. What kind of patients are you seeing?
My practice it's pretty amazing, I got to tell you. I'm very proud of the way my practice is developed. I have a spectrum of patients. I take care of young patients from the age of 19, 20-year-olds all the way to patients that are in their 70s. I take care of people that are CEOs, people who run their own businesses. I take care of housekeepers. It's pretty broad.
So you do facelifts, you do,
I do the gamut. I mean, honestly, okay. I do the gamut. I truly love plastic surgery because of its breadth. So I have never really, there's not one thing that I love so much that I want to spend the rest of my life doing. I love facelifts. I do breasts, I do body contouring, I do rhinoplasty is one of my favorite procedures to do. Honestly, I do body lifts now, which is very common. A lot of people losing a lot of weight loss after gastric bypass surgery is one of the more challenging procedures to do.
Okay, now let's talk about your background and training. You're board certified.
I am.
Plastic surgeon. And where'd you go to medical school?
I'm a Southern Cali guy. I did my undergrad at UCLA in LA, and then I went down to San Diego, and I did my medical school training in San Diego. And following that, I went up very far to USC, and I completed my training there. So I did general surgery and plastic surgery at USC. So I've spent all my life here in Southern California.
You're an artist as well.
I am. Right? I am. I love art.
Tell me about that. And photographer.
Photographer, artist. It's funny because when I was thinking of going into plastic surgery, at the beginning I wanted to be an architect. And architecture was a real passion of mine when I was a young boy. And as I started to kind of get into the sciences and dabble, I started to be like, wow, there's a lot to be said for science. And then one day it clicked, and I was like, science, art, and it's just nothing better than plastic surgery. So,
do you consider yourself an artist? I mean, when you're with a patient, do you see the end result in mind when you're
absolutely
doing a
There's no question about it. I think that in order to be an excellent plastic surgeon, you definitely have to have an artistic eye.
Your practice, I've seen it online, looks good.
Thank you. Actually,
you're a decorator?
Yeah, I'm a decorator. I'm very proud of my practice. We recently built a...
So you decorated it?
I built a beautiful office from scratch. I did all the decorating myself. I did all the space planning myself. I had a little dabbling in architecture, which is what I love. I picked all the staff. All the photography on the wall is mine. All the paintings on the wall are mine. And I made sure, I wanted it to be a place where I could spend the next 20, 30 years and just grow a practice. So I have everybody in sort of the particular places where they need to be. My staff and my office manager. So it's really.
And you speak Spanish?
Fluent.
Do you get a lot of Spanish?
I do. I get a gamut of patients, and I get a lot of Spanish-speaking patients. I have a real warm place in my heart for Latino community, and I did a lot of. When I was in San Diego, I was close to the border, and we would go across and do volunteering. And even in my training at USC, there was a lot of Latino patients. So as time went on, my Spanish got better, and they're just a great community.
So you're fluent?
Fluent.
So you speak Spanish on some of your consults?
So puedo hablar completamente en español.
All right, all right. Now your volunteer work. Tell me about that.
It's great. I go to Guatemala every year, and when I go down there with a group of doctors from Cedars-Sinai, where I'm on staff at the hospital, and we go out to rural areas in Guatemala. Basically it's like MASH. We set up a hospital out of nowhere.
Right? Okay.
We bring everything ourselves. We pay our own ways, and then when we get there, they know we're coming. So there's a huge outpouring of patients from all over Guatemala that come, and
a lot of cleft lip and palates.
Cleft lips, palates, burns, hand, congenital deformities, tumors, things like that.
So you do reconstruction. I mean, even in your own practice.
I do. I do the gamut of plastic surgery. I got to tell you, when I was choosing a profession and I knew that I wanted to do art and science, I knew that I wanted to do plastic surgery. And the thing about plastic surgery that's different than, say, cardiac surgeons or colorectal surgeons, we can do anything. if you're skilled and you have the art and the eye and you connect with the patients, you can do everything. And so my training was very, very extensive. And when I got out of training, I just couldn't bring myself to let go of any particular area. You know, I love the gamut of plastic surgery. So I do reconstructive surgery, I do breast cancer, and I think that allows me to be an excellent cosmetic surgeon. And the cosmetic surgery allows me to go for the finest details and reconstruct. They all play off each other. I mean,
you say you're changing people's lives. How so? I mean, with what you're doing, and we'll move into mommy makeovers in a moment.
Sure. I mean, I think
you see changes in personality.
Absolutely. There's no question about it. My patients come back, and one of the things that, you know, medicine in the art form, it's great. Surgery is awesome. I love to operate. I mean, when I'm in there, I'm in a zone. But one step higher than the surgery is the people. I mean, it's a people's profession. You interact with the patients, you talk to them, they connect with you, you go to their children's birthdays, I take care of kids, I go to their birthdays, and we connect with them, and then you know for a fact that you're changing lives because they tell you. You go to their parties and they invite you to things, they send you Christmas cards, and when somebody has a surgery, if it's cosmetic, they change their charisma, they change their energy, they're feeling sexy, they want to go out and conquer the world, whether it be reconstructive, then they are more functional, they have better form. So I know for a fact that at least when I am done with my profession, that I will have made a huge impact in many people's lives.
Good. Now, the demographic with the mommy makeover, who is it? I mean, are these working people? Are they housewives?
You know, the demographic
it's
pretty broad. The truth is today in the workforce, you know, people are no longer kind of categorized. I mean, we have women that are 25 years old and have 3 children and they're ready to, you know, get back into, you know, workforce. We have women that are 45 that are, you know, finished having their children. So I'd say that it's a real broad spectrum. I would say anywhere in women in their late 20s, all the way up until, you know, even their 50s. Because
so in a recession, people are doing this.
You'll be surprised. You know, there's definitely one thing for sure during a recession. You invest in your home and it's going down in value. You invest in stocks, it drops in value.
Yeah.
One thing that will always be is if you invest in yourself, you'll always get reward from that.
Do you find people doing that then?
They are more and more now because of the recession. If people have found that they got to, you know, they got to depend on themselves to be bring in that revenue and be productive.
Well, good. Okay, so you brought some photos. What are we going to look at here?
Well, what I'm going to tell you, this is a first patient of mine, and what I'm going to tell you about this patient is I categorize mommy makeovers into certain categories. In terms of breasts have several forms. After you have a baby, the natural progression of your body is to go as follows. You had perky breasts with volume. You breastfeed and you have several children, and what happens is you lose volume and your breasts descend or they sag, okay? So we deal with that commonly. And so when patients come in, and this patient particularly is a perfect example of that, she lost all the volume and her breast descended. And when you're dealing with volume, we're talking implants. When you're talking about sagging, there's 2 categories.
All right, so in this one, is this a lift? Is it a...
So this patient, when she came in saying, I want to have a fuller breast. She's working out like crazy and she lost volume, right? And when you look at it, you're like, she may need a lift. But in this instance, with the right selection of the implant, she was able to get enough volume and fill out her breast. And this lady was ecstatic. And, you know, she'd been working out because she wanted her 6-pack back, and she lost even more volume. And with the help of an implant, she has a beautiful, kind of a natural breast to her. So what was incredible about this patient, what she said to me that resonated in my mind was, you know, what drove her to come have it done wasn't so much that she wanted to have big breasts. She wanted to be able to wear a bathing suit. And as a guy, you know, people don't appreciate that as much, but that's essential to a woman's existence, is wanting to wear...
Want to have the cleavage again.
Cleavage, have, you know, feel sexy in lingerie, wear a bathing suit, and I think this very much the same.
Is there a lot of technique to breast augmentation and lifts? Because it seems, you know, that everybody's doing that.
Well, okay, that's a great point. This is it. Can you build any house? Anyone can build a house, but then can you build a magnificent house? And there's a lot of people doing plastic surgery today. The question you have to ask yourself is, do you want just any house or do you want a beautiful home? And a house is not the same as a home. And I would tell you that although people have a kind of not the really good understanding of it, but breast surgery, breast augmentations, and even more so breast lifts require finesse. That's why you can have 2 breasts, or you can have two breasts that are like this, or you can have 2 beautiful breasts. And behind clothing, everyone calls them breasts. But in intimacy, when you're with your partner or by yourself, you wish your breasts were symmetrical, the same size.
A lot of technique involved.
Absolutely. There's no question about it.
Okay. Now the next patient, what are we looking at?
So the next patient that I have here is another young lady who came in, and she too was a patient who had lost volume in her breast. She had breastfed 2 children and wanted her breasts back. She complained specifically that when she was with her husband, she didn't feel sexy anymore.
Okay.
And so with the help of the augmentation, giving her a great result, and she wanted to be natural. That's something that I hear all the time.
They want to be natural.
Natural, of course. And one of the things that I try and do is guide my patients, because some patients know what they want. But then some patients need a little guidance. And I spend maybe an hour and a half in each of my consultations, which is a lot of time. Because for me, all that matters is that you're happy.